A cleft lip is when there's a gap in the lip. Essentially, the two bits of the lip have not fused properly when the baby was in the mother's womb. So when the babies are born, there's a gap in the lip, and I repair those. A cleft palate is often when there's a gap in the palate inside the mouth or the roof of the mouth, which can interrupt the way we speak and also creates a communication between the mouth and the nose. So this would be a cleft palate repair. One of my specialties is cleft lip and palate surgery. I'm a cleft lip and palate surgeon in the NHS, and I typically look after patients who are born with a cleft lip and cleft palate. I operate on babies and I follow them up and operate on them when they're adults for cleft septal which is a nose job for patients who had a cleft. A cleft lip revision typically involves cutting out the old scar, and we may need to realign the various segments of the lip. In a lip, we've got the pink bit that is here, we have a white roll, and then we've got skin. Often in these patients who want a cleft lip revision, we need to excise it and make sure that all the bits match correctly. In an adult, often what we find, if they're a little bit older, in their 20s, 30s, 40s, when they've had a cleft lip repaired many, many years ago, if there are some discrepancies, they often find that the white roll, there's a step, so it doesn't follow a nice smooth curve. The other complaint that patients typically complain of is their lip starts to crack. In the top lip or in bottom lip, we have a dry mucosa, the pink bit is dry, and there's an element of it that is wet on the inside. If the lip repair wasn't done properly in the first place, or if the scar has contracted, the wet mucosa becomes exposed, and therefore when it gets cold in the winter time, this lip scabs and starts breaking and bleed. So in a lip repair in an adult or a cleft lip revision in an adult, we would excise the whole segment, realign everything to make sure that the wet segment of the lip is tucked inside, the dry segment is the bit that is exposed, the white roll follows a nice smooth curve, the muscles in the right place, and often we may need to make sure that the base of the nose are set at the right level. Please don't hesitate to get in touch with our team at Emendo Surgical Group, and we would be delighted to see you.